Hello, beautiful people. I'm Elena. I'm a licensed clinical social worker, though I prefer the term psychotherapist since that's primarily what I do. I thought I would create a video on how to start therapy. Now, in 2025, we're doing a much better job than we have in the past in terms of reducing mental health stigma and getting more people into therapy, which is absolutely amazing. I thought it might still be helpful to create a little guide to help people feel a little bit more comfortable with starting that journey. I have a little visual here just to help me talk to you when we see information visually, words on a page. I think we process that information a little bit better. So it helps me and hopefully it helps you too. So, starting therapy can feel like a major challenge. Even for me, I was already a therapist when I first started going to therapy. Now, I had gone to some school counseling here and there throughout like elementary school, middle school, and a little bit of high school maybe. Where I was in like in-school counseling programs. Then I stopped for many years. I didn't really have individual therapy sessions. COVID came, a breakup came, some deaths around me came, and I said, you know what, it might be time to try. I spoke to a very close friend of mine, and she recommended somebody to me. And I'm still with that therapist today, 4 or 5 years later. And I'm really grateful for that experience. So even if you're a therapist and you're like, oh, I don't know if I need that, I should do that, I don't know anything about, really taking that leap myself, even though I recommend it to others all the time, start to think about it and maybe this guide will help. I created some steps for you to break this big task of going to therapy into some smaller chunks. And that's an approach I take to a lot of projects in my life. I take a big project and I break it down into smaller steps. So let's get into that together. Why start therapy? A common misconception is that you need to be in a super duper crisis to start therapy. You don't need to be in psychosis. You don't need to be at risk of harming yourself or others. You could just be dealing with stressors day to day, and that's a good enough reason to start therapy. And I don't see therapy as a place where things just get fixed. I see it as a place where you learn more about yourself, learn more about your relationships, and you grow. You imagine going to school and you're studying science, and you just learn so much better when you're with a tutor. You have that one-on-one connection that just helps your relationship grow, your love for the subject grow. And that's kind of how I think of therapy. It's a tutor for learning about yourself. So some common reasons that people go to therapy that you are probably already familiar with: anxiety, panic attacks, depressive symptoms, stress and burnout, work issues, trauma is a big one. Even if you don't qualify for every PTSD marker, if you have experienced any kind of traumatic event, that's a big reason to maybe consider starting. Relationship issues, life transitions, and life transitions can mean really like anything that's shifting in your life. Meaning, oh, I'm going from middle school to high school, or I'm moving on to college, or I'm having a baby and I have no idea what that's going to be like. Right? So life transitions can mean a whole bunch of different things. But therapy is for anybody wanting support, healing, growth, just some compassion in your life. Maybe you don't have a lot of compassionate people around you and you just need that non-judgmental space to learn about yourself, to grow. First step, figure out what you need. So this is where you maybe want to journal, write a few things down in your phone app, and just kind of consider, what am I struggling with right now? Is it a life transition that we were just talking about? Is it anxiety? Is it depression? Do I want short-term or long-term support? Sometimes people say, you know what, I want to give this a try for a few months. Let me see what I get out of this. Some people say, you know what, I think I need therapy throughout my entire life. I told you that I've been going for like 4 or 5 years myself. I don't really see myself stopping therapy anytime soon, so I want long-term support personally. But I've even had somebody come in to my virtual office before and say, I only can do 6 sessions. That's what I can financially afford, and that's all I'm interested in. Can we do something like that? And sure, when we put that kind of a time constraint, it is a little tough to make progress because therapy is a very ongoing process in my mind. But I was still able to provide some tools as a therapist to a client who only wanted a few sessions. So try to figure out what you want, what you're craving, what you're looking for, and be open that it can change. You might go in starting with wanting short-term support, and then you realize, oh wait, you know what? I think I need something for a longer length of time. And that's okay. It's okay for that to shift and change. I want to ask yourself, do I prefer a structured approach or more of just an open conversation? Some therapists really love using manuals and protocols, and some therapists use more of a conversational approach where they're taking from different modalities and bringing it in. So it's just about finding what's good for you. Maybe you really like that structured approach. Maybe you like that flexible conversation. Maybe you have somebody that does a little bit of both. I think I fall maybe into that camp where sometimes I use a worksheet here or give a homework assignment there, but a majority of the time we're just conversing and exploring and asking each other questions. It's good to think about what kind of approach you might like there. And another thing that you might consider is, do you want somebody of a particular identity? Is ethnicity important to you? Race, religion, sexuality, gender? Are any of those things really important to you when finding a therapist? Because ultimately you have to feel comfortable with your therapist. You have to feel like you can be open and transparent and honest. And there's nothing wrong with having any one of those preferences. It's just about finding the right fit for you. Step 2. Now this, I think, is actually an optional step. So sometimes people go and they look for a therapist with a particular modality. I really want an EMDR therapist. EMDR is very popular and like all the rage right now in the therapy world. Now, some people go in with an idea of the therapy modality and they think that is what I need, right? Whereas a lot of modalities actually treat similar things. There's a lot of overlapping concepts between different therapy approaches. So I say be open, be curious. If you go in wanting EMDR, but maybe you get somebody that does a lot of CBT, it doesn't mean you won't benefit. You might still benefit from the experience. You might still gain a lot of new insights. So I'm not saying don't research it. If you're curious about it, you're passionate about it, you have an interest in learning about different types of therapy, go for it. Learn about it. We'll go over, some of them briefly right now. But what I'm saying is be open. You might get a therapist using some kind of approach that you didn't expect, and you might love it anyway. So some therapy modalities that are often seen on different websites that you might go to find a therapist are CBT. So that stands for cognitive behavioral therapy. So that focuses on how thoughts, feelings, and behaviors, how they connect, how they interact. If you've ever heard somebody say, let's reframe that thought, that is an approach from CBT. Psychodynamic focuses on past and unconscious patterns. So if you've heard of Freud, you will think of psychodynamic approaches. I mentioned EMDR, eye movement desensitization reprocessing. So that is often an approach used for people that have gone through really traumatic events, and most commonly using bilateral stimulation. If you've ever seen somebody do a butterfly hug, this tapping motion here, that can be an EMDR approach. Or you might see somebody use like a virtual ball or their fingers moving back and forth. We're using both sides of the mind, of the body, to help the mind and body feel a little safe and reprocess different memories. That is a very overarching overview of that approach. Then there's a humanistic approach, which is just focusing on self-growth, self-acceptance. I think a lot of therapists will use a humanistic approach in addition to other approaches. You might have heard the word somatic. All that means is that you're in your body. You're focusing a lot on being in your body. A somatic approach, again, helpful for people that have gone through really intense traumas, maybe violence, and helping you just feel a little bit safer. So like I said, this is an optional step. You don't need to pick one. Your therapist will help guide you. Your therapist might use, 40 different approaches to help you because they're trying to figure out what is going to fit you the best. Just stay open to the process. Be curious about it. That is my biggest advice in all of this. Step 3 is actually finding the therapist. Let me move my camera here. Alma is a fantastic resource. Go to helloalma.com and you can put in a bunch of different preferences, insurance companies there. Really great resource. Psychology Today, huge resource. Again, finding out who are different therapists that are in your area and if you want them online or in person. So a lot of these websites will help filter those options for you. Please note that your therapist should have a license in wherever you're living. For example, if you're living in Florida, your therapist should be licensed in Florida. Your therapist doesn't necessarily have to live in a particular state, but they need to be licensed there in order to treat you. So that is something important to note as well. Let's say you have a friend in Oklahoma that really loves their therapist, and you're living in Florida. If that therapist is not licensed in Florida, but they are only licensed in Oklahoma, they cannot help you. So you'd have to filter out using your location, using your insurance if you have insurance or if you want to use your insurance, and any other preferences that you may have. So step 4 is that first contact. Step 4 is emailing, calling, messaging a therapist. I say do this a few times. Find multiple different therapists. Sometimes therapists won't always answer. Maybe they're overbooked. Maybe they don't have room for any consultations. So I say pick a few when you go on those websites that I mentioned and send a message to multiple. And say something like, hey, I'm looking to start therapy and I found your profile. I've been dealing with trauma for 3 years and I am just trying to work on getting some tools to feel a little bit better. Are you accepting new clients? I'd love to schedule a consultation. It could be a very brief message. You don't have to go too in depth. I do recommend stating a little sentence about something that you've been going through, because that could also help filter out therapists that are not always a good fit for you, right? So let's say you have a very extensive trauma history and you reach out to a therapist that really focuses only on anxiety. Now this is just a hypothetical because a lot of therapists will treat trauma regardless because that is such a crucial part of what therapists do. But I'm just kind of giving a vague example here. So if you give them a sentence about what you're looking for and they say, you know what, I'm not good at this, but I know another therapist who is, they can then point you in that direction. So I recommend stating just like a sentence or two about what you're dealing with in your first contact there. And what's great is that most therapists offer a free 10 to 15 minute phone call or video call kind of consultation to see if you two would make a good fit, or if you're going for couples therapy or family therapy, you want to get everybody in there to meet each other for those first 10-15 minutes to just kind of explore. So it may take a few sessions for you and the therapist to figure out if you're a good fit. Part of that is done in the consultation call. Sometimes you could figure it out right then and there, but sometimes it does take a few sessions. So some things to note about those first few sessions. Expect intake questions. I know I personally do a really long assessment. I'm trying to really understand you as a person in our first few sessions because I want to make sure that I have the tools that I need in order to treat you. I want to see if we're a good personality fit, and I want to know where your symptoms are coming from. Are there things that happened in your childhood that maybe we could briefly touch on? We don't have to go in depth in that intake, but it's good to know and say, oh, you know what? I'm going to take a note of that and just mark that down in my paperwork so that we can return to it when you're ready. So you're going over some history, any goals you have for therapy. A lot of goals that clients have are trying to work on anxiety symptoms. So how can I learn how to handle stress? That's a fantastic goal to start with. And what are the symptoms that you're experiencing? Are you having trouble sleeping? Are you having frequent panic attacks? Are you reliving a memory over and over and over again? Right? So what are the different symptoms that are happening in your life? Remember to be as honest as you can. Even if you don't want to talk about something, just say, hey, I don't want to talk about that right now, and try to return to it later. Know that it's okay to feel nervous. Like I told you before, I was very nervous going into therapy. I still get nervous sometimes, especially if I know I need to talk about something I don't want to talk about. I get nervous. And another thing that you can do is ask about their approach and what to expect going forward. Think of it as a first coffee date with a new friend. You're feeling it out, they're feeling it out. You're just learning and exploring, even in that first few sessions together. What happens if it's not a fit? You or your therapist may decide that you're not a good fit for each other clinically. If you feel like they're not a good fit for you, trust your gut. It's okay to switch and find somebody new. Look for somebody who helps you feel heard, respects your boundaries, and encourages growth. Unfortunately, I've heard therapist horror stories, so it's not going to be perfect every time. But there are a lot of amazing, amazing therapists out there that are so compassionate and that are looking out for you. And so give it another try. Give it another switch. It might take multiple therapists for you to find the right fit. Know that that's a normal experience that people have. And know that you're not locked in. Therapy is a collaboration. You're supposed to look out and find who's a good fit for you. So what if the therapist says you're not a fit, right? So either the client or the therapist can see, oh, you know what, this isn't going to work out well. Don't panic. It's really not a rejection. It's actually something that I think can help you, because therapists want you to get the best help possible, and they might know that they can't provide you with the support you may need. As a therapist, I realize that I do have some limits. There are some diagnoses I'm really not good at treating at, or there are times where maybe I try to do too much work for my client and then they're not pulling their weight too. So you want to make sure that it feels like a smooth relationship where your personalities mesh, the style works, maybe they need a specialty that you require. If a therapist says, you know what, I don't think we're a good fit, it's really because they care about your experience and they want you to have good outcomes. Not because they don't like you or that they want to reject you. Not at all. It's really just about finding the right match. Some additional tips for success. Now, I said this multiple times in this video so far, but be open and be curious. Ask questions about yourself. Ask questions to the therapist. Just explore. The second bullet point here, therapy is not always comfortable, and that's okay. I've had a few clients that start therapy with me, and they're like, I don't know why I'm coming. This feels awful. I hate this. And then they can't stop coming and stop showing up because they're like, yeah, I was looking forward to therapy this week, right? It becomes a safer space the more you go and the more you feel comfortable and open and get to know your therapist. Now, it's not always comfortable because sometimes you're talking about really dark and heavy things, but that's what therapy is for. It's to unload some of those things. Like I said, you might come in and you might hate talking about every single one of those things, but then you just learn how to adapt. You gain tools to help you with your stress, to help you with your anxiety, and things might get a little bit better. Another thing is that you don't need to have the right words. A lot of people come into therapy saying, I don't know what to say. And that's okay. You can also just sit in silence. I've had sessions with clients where we're just kind of there with each other. We know we're there with each other, even if we don't have words. Sometimes it's just being with somebody who's compassionate, somebody who cares about you. And that's okay. Words aren't everything. And that's a lesson that I am trying to continuously learn, because even as a therapist, I feel pressure to speak, pressure to say something, even when I don't always have something to say. So I say, don't worry about the words. Just show up. Try to use the tools that your therapist gives you and move forward the best you can. And that brings us to our fourth bullet. Keep going. Healing takes time. It takes a lot of time. Don't expect to feel better in a month. Don't expect to feel better, in 2 months. Because everybody moves at a different pace. There's no one size fits all. Some people have felt better after a year. Some people have felt better after 3 years. I have some clients that I saw for 4 years and they couldn't believe the progress that they made. They never thought they would get to where they are. So just go at your own pace, and remember, healing takes time. So some reminders and a recap. Therapy is a really brave step. You don't have to go if you're not in you don't have to be in a crisis to go. Look, see about the right words. That was such a good example right there. You don't have to have the right words. You could stutter. You can be unnatural. It's okay. Just show up, right? And that's something that I challenged myself here in making this video. I knew it wasn't going to be a perfect video, but I'm just showing up because I think that this is an important topic and people should go and take the leap and go to therapy. It's a brave thing to do. And so I'm trying to show up authentically as I am and encourage you to go too. And I'm going to do it imperfectly. You deserve the support when you're going through something really hard. And you don't have to figure it out alone. Have a therapist there. There are a lot of people in this world that feel really alone, that don't have compassionate people in their corner. Go find a therapist that sees you for who you are as a whole person, and that just sits with you in a non-judgmental space. So if you liked this guide, if you found this to be supportive, please like, comment, and subscribe if this helped. And maybe share this with somebody thinking about starting therapy too. Thank you so much for watching this. I appreciate it so much. If you want to connect further, check out the description for my other social media accounts. Wishing you all the best. Thank you so much.